In the analyze phase of DMAIC, define, measure, analyze, improve, control, a team finds that the primary cause of a process delay is an inefficient handoff between two departments. Which tool would most effectively help visualize and quantify the impact of this inefficiency, and why? Answer: the most effective tool for visualizing and quantifying the impact of an inefficient handoff between two departments is a Pareto chart. This chart is based on the Pareto principle 80-20 rule, which states that a majority of problems, about 80%, are often caused by a few key issues, about 20%. By using a Pareto chart, the team can identify the most significant causes of delays and prioritize them for improvement. This helps the team focus their efforts on addressing the most impactful inefficiencies. In addition to the Pareto chart, the cause and effect diagram, Ishikawa or fishbone diagram, can be used in the analyze phase to identify potential root causes of the handoff delay. This diagram helps categorize factors such as people, processes, technology, and the environment, allowing the team to explore each cause systematically. Relevant guideline: Lean Six Sigma's DMAIC methodology emphasizes data-driven analysis and aims to identify and address root causes through structured tools like Pareto charts and cause and effect diagrams, which ensure that solutions target the underlying problems. Maria, a healthcare data analyst, is tasked with optimizing the workflow of a hospital's radiology department. She notices frequent delays caused by radiologists waiting for patient data from the EMR system. Additionally, radiologists and technicians are unsure about their specific responsibilities during data entry and verification. What steps should Maria take to address these bottlenecks, and which workflow visualization tool would be most suitable to identify accountability issues? Answer: Maria should follow a systematic approach to identify and address the bottlenecks in the workflow. Identify bottlenecks. Maria should start by observing the entire process to pinpoint where delays happen. Interviews with radiologists and technicians can reveal how long it takes for data to be accessed and where inefficiencies occur. Map the current workflow. Using a swim lane diagram, Maria can visualize the current workflow. This tool divides the process into lanes, each representing a specific role, e.g. radiologist, technician, administrative staff. By clearly mapping out who is responsible for each step, she can identify overlapping duties or unclear responsibilities, which are likely causing delays. Redesign the process. Maria should propose changes to streamline data entry and verification. For instance, she can automate the data retrieval from the MR system and create standardized procedures to clarify the roles and responsibilities of staff. Measure results. To ensure the new process works, Maria should track KPIs such as the time it takes to complete a radiology report and staff satisfaction with the changes. Compare and contrast the Advanced Encryption Standard (AES) and RSA encryption algorithms in terms of their application for securing healthcare data. Which would be more suitable for encrypting large amounts of patient records at rest, and why? Answer: AES and RSA serve different purposes in the realm of data security. AES Advanced Encryption Standard is a symmetric key algorithm that uses the same key for both encryption and decryption. It is extremely efficient for encrypting large amounts of data, making it ideal for securing patient records at rest. AES operates on fixed-size blocks of data, 128 bits, and supports key sizes of 128, 192, or 256 bits. Its high efficiency and speed in handling bulk encryption tasks make it the preferred choice for securing large datasets like medical records. Additionally, AES is widely recognized for its robustness against brute force attacks. RSA, on the other hand, is an asymmetric encryption algorithm using two separate keys for encryption and decryption, public and private keys. RSA is generally used for encrypting small amounts of data, such as securing the transmission of encryption keys, rather than encrypting large datasets. The main disadvantage of RSA for bulk data encryption is its computational complexity, which makes it slower and less efficient than AES for encrypting large volumes of information. A hospital IT department is deciding between agile and waterfall methodologies for implementing a new electronic health record (ER) system. What are the key factors that should influence this decision, and which methodology is more appropriate for this type of project? Answer: when deciding between agile and waterfall methodologies for implementing an HR system, several factors should be considered. Project scope and requirements. If the scope of the project is clearly defined with well-understood requirements, waterfall may be more suitable. Waterfall is sequential and each phase is completed before moving on to the next, which works well for projects with fixed requirements. However, if the scope is likely to evolve as user needs are gathered throughout the project, Agile would be more appropriate. Agile is iterative, allowing for continuous feedback and adjustment. Stakeholder involvement. Agile requires frequent interaction with stakeholders throughout the project to ensure the evolving product meets their needs. If regular feedback from medical staff and other users is important, Agile is a better fit. Conversely, Waterfall is less flexible in this regard as stakeholder involvement is primarily limited to key phases. Risk management. Agile's iterative nature allows for the identification and resolution of risks early, making it ideal for projects with uncertain or evolving requirements. Waterfall is riskier in this regard as risks may not be discovered until later stages of the project. What strategies can a healthcare organization use to minimize resistance during the adoption of a new telehealth platform, and how should adoption metrics be tracked to measure success? Answer: to minimize resistance during the adoption of a new telehealth platform, a healthcare organization can implement the following strategies: engage stakeholders early, involve key stakeholders including clinicians, administrative staff, and patients early in the process, gather feedback on their concerns and address them in the planning stages, provide comprehensive training and support, offer training sessions to ensure that users are comfortable with the new platform. Additionally, provide ongoing support through help desks or dedicated resources for troubleshooting, communicate the benefits, clearly communicate how the telehealth platform will improve patient care and increase efficiency. Adoption metrics. Training completion rate. Track how many staff members have completed the training. Utilization rate. Measure the number of telehealth consultations conducted relative to in-person visits. Patient and staff satisfaction. Use surveys to assess the satisfaction of both patients and staff with the platform. Dr. Nguyen's clinic discovers unauthorized access to patient records over the past 2 weeks. What steps should the clinic take to comply with reporting obligations under HIPAA? Answer: Dr. Nguyen's clinic must follow these steps to comply with HIPAA's breach notification rule. Immediate containment. First, the clinic must block any unauthorized access to prevent further breaches. This includes securing affected systems and revoking access to unauthorized users. Investigation. The clinic must conduct a thorough forensic analysis to determine how the breach occurred, what data was exposed, and who the affected individuals are. Notification. The clinic must notify all affected individuals within 60 days of the breach. The notification must include information about the breach, the data involved, and steps the individuals can take to protect themselves. If the breach affects 500 or more individuals, the clinic must also report it to the Department of Health and Human Service (HHS) Prevention. After the breach, the clinic must take steps to prevent future incidents. This may include improving access controls, revising security policies, and providing staff with additional training on data protection. How can data integrity be ensured when transferring patient data between different hospital systems, and which auditing practices should be employed? Answer: to ensure data integrity during the transfer of patient data, healthcare organizations should implement the following measures: data encryption. Use encryption to secure data during transmission, ensuring that patient data cannot be tampered with while in transit. Data validation. Implement automated validation processes to check for errors or discrepancies in the data as it moves between systems. This can include checking for missing or corrupted data. Secure APIs. Utilize secure application programming interfaces (APIs) that facilitate reliable data exchanges between systems. Auditing practices. Log monitoring. Regularly review access logs to track who accessed patient data, when and for what purpose. This helps identify any suspicious activity. Regular audits. Conduct periodic audits of system logs, transaction histories, and security measures to ensure compliance with data integrity standards and regulations like HIPAA. What is the role of data standardization in healthcare analytics, and how does it impact the quality of insights derived from electronic health records? Answer: data standardization plays a crucial role in healthcare analytics by ensuring that the data from different sources is consistent, accurate, and comparable. Without standardization, data from multiple EHR systems may be inconsistent in terms of format, units, and terminology, which can lead to unreliable insights and incorrect decision-making. The standardization process involves converting data into a common format using recognized coding systems like ICD-10 for diagnosis, LOINC for lab results, and SNOME, DCT for clinical terms. By ensuring that data from diverse sources is harmonized, healthcare organizations can create accurate and actionable insights across departments and systems. Impact on analytics. Standardized data improves the accuracy of predictive analytics, clinical decision support, and population health management. It allows analysts to identify trends, track patient outcomes, and evaluate the effectiveness of treatments. Relevant guideline. HL standards help ensure interoperability between different health information systems, facilitating the accurate exchange of standardized data. How can predictive analytics be utilized to improve patient outcomes in chronic disease management, and what data sources should be considered for effective modeling? Answer. Predictive analytics can be used in chronic disease management by analyzing historical patient data to predict future health outcomes. By identifying patterns in patient behavior, treatment responses, and disease progression, predictive models can help healthcare providers intervene early, personalize care, and improve patient outcomes. Data sources for predictive modeling include HR data includes patient demographics, medical history, diagnoses, lab results, and medication records. Wearable devices. Data from wearable devices can provide real-time information on vital signs such as blood pressure, heart rate, and physical activity, which can be used to detect early signs of deterioration. Social determinants of health. Data on lifestyle factors, socioeconomic status, and environmental conditions can help predict health risks and outcomes. Relevant guideline. The National Quality Form (NEF) supports the use of predictive analytics for improving healthcare quality and outcomes through timely interventions. What are the key components of a data quality framework for healthcare organizations, and how can they be applied to ensure high-quality patient data management? Answer. A data quality framework for healthcare organizations should include the following key components. Data accuracy, ensuring that patient data is correct, complete, and free of errors. Data consistency, ensuring that data is consistent across different systems and departments, preventing discrepancies. Data completeness, ensuring that all necessary data fields are filled and that no critical information is missing. Data timeliness, ensuring that data is available when needed for decision-making with up-to-date information. Data validity, ensuring that data is relevant and appropriate for its intended purpose. To apply this framework, healthcare organizations should implement continuous monitoring and auditing processes, use standardized data formats, and promote a culture of data quality through staff training and accountability. A hospital has a high volume of patients assigned to high-weight DRGs. Upon audit, it is found that some DRG assignments were incorrect due to missing secondary diagnoses. Discuss the potential financial and compliance implications of this finding and outline corrective actions the hospital should take. Answer. Incorrect DRG assignments can lead to financial implications, overpayment recovery. Payers may demand reimbursement for overpaid claims due to incorrect DRG assignments impacting cash flow, revenue loss, missed opportunities for legitimate reimbursement if secondary diagnoses are omitted, compliance implications, fraud allegations. Repeated inaccuracies might trigger investigations under the False Claims Act. Loss of accreditation. Coding inaccuracies could affect quality scores and compliance with CMS regulations. Corrective actions. Conduct thorough internal coding audits to identify patterns of errors. Implement education and training programs for coders. Utilize computer-assisted coding (CAC) systems to enhance accuracy. Establish a robust clinical documentation improvement (CDI) program. Explain the role of data normalization in achieving interoperability in health information exchanges (HIs). Why is this process critical, and what challenges does it address? Answer. Role of data normalization. Ensures data consistency across multiple systems by standardizing terminologies and formats. Facilitates seamless communication between different HR systems and HIs. Criticality. Overcomes semantic differences e.g. one system using ITEN, another using SNOME. DCT supports data analytics by providing comparable data inputs for public health reporting and care coordination. Challenges addressed. Vendor lock-in. Proprietary formats hindering data exchange, data variability, disparate coding systems, and unstructured data requiring mapping. Accuracy risks. Errors introduced during translation or conversion processes. Standards such as HL, HIR, and LOINC are pivotal for effective data normalization. Dr. San Hu, the Chief Information Officer (EO) of a mid-sized hospital, has implemented a centralized HIE model to improve data sharing. However, during a review, it is discovered that the system struggles with patient matching and often produces duplicate records. How should Dr. San-Hu address these issues to optimize the highest functionality? Answer: Dr. San-Hu should take the following steps. Patient matching algorithms. Enhance probabilistic matching algorithms by incorporating additional patient identifiers, e.g., biometrics. Address standardization. Data quality initiatives. Focus on collecting complete and accurate data at the point of care to reduce duplicates. Collaboration with stakeholders. Ensure consistent data entry standards across participating providers. Master Patient Index MPI. Utilize an enterprise MPI to manage patient identities and link records accurately. Audit and monitoring. Conduct regular audits to assess and refine matching performance. This aligns with ONCT interoperability standards advisory for HIEs. A medical coder is tasked with assigning a PCS code for a laparoscopic cholecystectomy. Discuss the key factors that must be considered to ensure the code is accurate and explain the potential consequences of misclassification. Answer: key factors. Specificity. Accurately capturing the approach laparoscopic and anatomical site, gallbladder. Procedure context. Distinguishing between diagnostic and therapeutic interventions. Guidelines compliance. Following ICDEN PCS coding conventions for root operations, body part and device specification. Consequences of misclassification. Financial penalties or denial of claims if the code affects reimbursement. Data quality issues impacting care analytics and performance metrics. CMS-PCS coding guidelines emphasize the importance of accurate, complete, and compliant code assignment. Describe how health information exchanges HIEs enhance public health reporting during a pandemic. What challenges might arise and how can they be mitigated? Answer: enhancements. Real-time data sharing supports disease surveillance by aggregating data across regions. Analytics and predictive modeling identifies trends in infection rates and healthcare resource needs. Challenges: data quality issues, incomplete or inaccurate reporting, interoperability barriers, lack of standardization across providers, privacy concerns, balancing public health needs with HIPAA compliance, mitigation strategies, enforce standardized reporting formats, e.g., HL, strengthen governance frameworks for data use, increase funding for infrastructure to support timely data exchange. What is the difference between internal and external coding audits, and how does each contribute to coding compliance? Answer: internal audits. Internal coding audits are conducted within the healthcare organization, often by the internal compliance or coding department. These audits aim to proactively identify areas where coding practices can be improved, ensuring adherence to internal policies and payer guidelines. External audits. External audits are conducted by third-party agencies, typically payers or regulatory bodies. They are formal reviews designed to ensure compliance with external standards such as CMS guidelines and payer contracts. These audits evaluate the accuracy of coding for reimbursement purposes, with the potential for overpayment recovery or penalties for non-compliance. External audits are less frequent but hold more weight due to their legal and financial implications. Contribution to compliance. Both audit types promote coding compliance by identifying inaccuracies that may affect reimbursement and quality reporting. Internal audits focus on proactive compliance and staff education, while external audits serve as an external check that validates the organization's coding practices and ensures financial and regulatory compliance. Compare the centralized and federated models of HIEs. What are the advantages and limitations of each? Answer: centralized HIE. In a centralized HIE model, all patient data is stored in a single repository managed by a central organization. Healthcare providers access this central database to retrieve patient information. Advantages: quick access to data. Providers can quickly query the central system for patient data. Simplified data management. Easier to update and maintain data in a single system. Efficient data aggregation. Facilitates analytics, reporting, and public health tracking. Limitations: privacy risks. Centralized storage increases the risk of a large-scale data breach. Costly to implement. Significant infrastructure investment is needed for data storage and security. Vendor lock-in. If the system is not interoperable, it can lead to reliance on one vendor. Federated HIE. In the federated model, patient data remains at the source, e.g., individual healthcare facilities, and only references or metadata are exchanged. Advantages: reduced privacy risk. Since data stays local, there is less exposure to large-scale breaches. Flexibility and control. Organizations retain control over their data and are not reliant on one centralized system. Limitations: slower data access. Providers must query multiple sources, leading to longer wait times, complex integration, more difficult to ensure seamless interoperability between diverse systems. The choice between these models depends on organizational needs, resources, and the scale of healthcare data exchange required. Explain how coding accuracy influences reimbursement in the outpatient prospective payment system (OPS). Answer: in the outpatient prospective payment system (OPS), reimbursement is based on ambulatory payment classifications (ACs), which group similar outpatient services for payment purposes. Coding accuracy is vital to ensure the correct APC is assigned, as this directly influences the amount of reimbursement a healthcare facility receives. Accurate coding. Proper coding of diagnoses, procedures, and services ensures that each patient encounter is classified into the appropriate APC. This allows for accurate reimbursement that reflects the complexity of care provided. If procedures or diagnoses are undercoded or omitted, hospitals risk receiving less reimbursement than deserved. Impact of errors. If codes are inaccurately assigned, the facility may face underpayment where the payment is insufficient to cover the services provided. Overcoding, on the other hand, can result in overpayment, potentially triggering audits and refund requests from payers. Consistent errors can also lead to investigations under the False Claims Act if the inaccuracies are deemed fraudulent. Maria, a coding supervisor, finds that a coder consistently misses secondary diagnoses in patient charts. What steps should Maria take to address this issue and ensure compliance? Answer: Maria should follow a structured approach to address the coder's mistake and ensure compliance. Root cause analysis. Maria needs to understand why secondary diagnoses are being missed. Is it due to lack of knowledge, workload pressures, or unclear documentation? Conducting a review of the affected cases will help identify if the issue is widespread. Education and training. Provide the coder with targeted training on the importance of secondary diagnoses in coding. This should include instruction on identifying clinically significant conditions and understanding their impact on reimbursement. Clinical documentation improvement. Encourage collaboration with clinicians to ensure that secondary diagnoses are documented clearly. Often a lack of documentation can result in misdiagnoses. A CDI program can assist in improving documentation clarity. Implement peer reviews. Introduce peer reviews where coders cross-check each other's work. This can help catch errors early and encourage accountability. Ongoing audits. Conduct periodic internal audits to ensure that coding practices remain compliant and accurate. Regular audits will identify trends and allow Maria to provide continuous feedback and support to the team. By addressing this systematically, Maria will improve coding accuracy, mitigate compliance risks, and align with OIG compliance standards. How can HIE data be leveraged for predictive analytics in reducing hospital readmissions? Answer: Health information exchange (HIVE) data can be a valuable resource in predictive analytics for reducing hospital readmissions. By aggregating patient data from multiple sources, healthcare providers can gain deeper insights into the factors that contribute to readmissions. Here's how HIE data helps: identifying high-risk patients. Predictive models can analyze data such as chronic conditions, social determinants of health, medication adherence, and previous hospitalizations to identify patients at high risk of readmission. Data from different hospitals, specialists, and care settings can be integrated into a single, comprehensive patient profile. Personalized care plans. With the insights gathered, healthcare providers can implement targeted interventions such as increased follow-up appointments, home health visits, or tailored discharge instructions to prevent complications that may lead to remission. Monitoring outcomes. HIE data allows for continuous monitoring of patient health status after discharge, providing real-time information that can prompt early intervention if signs of deterioration appear. A hospital system is implementing a new health data analysis platform. What steps should the hospital take to ensure compliance with ethical guidelines and legal standards related to data custodianship and patient consent? Answer: the hospital should consider the following steps. Data custodianship. Establish clear data governance policies outlining who owns, accesses, and manages patient data. Appoint a data custodian responsible for safeguarding data integrity and access control. Regularly audit data access logs to detect and prevent unauthorized access. Patient consent. Use an opt-in model where patients actively agree to their data being used. Provide detailed, understandable information about how their data will be used, aligning with informed consent principles. Allow patients to withdraw consent easily and ensure no further data processing occurs post-withdrawal. Regulatory compliance. Align with guidelines like HIPAA, Health Insurance Portability and Accountability Act ensuring protection of identifiable health information. If data includes minors or incapacitated individuals, secure consent from guardians. Ensure all data usage adheres to the common rule for research involving human subjects. Dr. Susan leads a research team that uses machine learning algorithms to analyze patient outcomes for predictive modeling. She discovers that the algorithm disproportionately predicts poorer outcomes for minority populations. What should Dr. Susan and her team do to address this bias, and what ethical principles should guide their response? Answer: Dr. Susan's team should identify bias sources, examine the training data for underrepresentation or imbalances, assess if historical inequities in care delivery influence the data, mitigate bias, use resampling techniques to balance the dataset or add synthetic data for minority populations, apply fairness metrics, e.g. demographic parity, to evaluate algorithmic output, transparency, document the bias findings and publish corrective measures, include diverse stakeholder input when refining the algorithm, ethical guidelines, follow the Belmont Report principles of justice to ensure fair treatment of all populations, align with the ACM Code of Ethics by avoiding harm and ensuring inclusivity. What are the potential challenges and benefits of using blockchain technology in managing patient consent for data sharing? Answer: challenges. Technical complexity. Implementing blockchain requires technical expertise and integration with existing healthcare IT systems. Scalability. High data volume from health records constrain blockchain networks. Data privacy. While blockchain ensures immutability, ensuring that data is stored securely off-chain remains critical. Benefits. Data integrity. Blockchain provides a tamper-proof ledger ensuring reliable audit trails for data access. Patient control. Patients can manage consent granularly through smart contracts. Interoperability. Blockchain facilitates seamless data sharing across disparate healthcare systems. Adopting blockchain can enhance trust and efficiency in health data management, provided challenges are addressed with robust infrastructure and governance policies. In the context of IONT's Internet of Medical Things, how can real-time data from wearable devices improve chronic disease management, and what risks should analysts mitigate? Answer: improvements. Personalized insights. Wearable data allows customized treatment plans based on continuous monitoring, e.g. glucose levels for diabetics. Early intervention. Predictive analytics can identify trends, e.g. irregular heart rate, for timely intervention. Patient engagement. Wearables empower patients to manage their health, actively improving adherence. Risks. Data privacy. Continuous data streaming increases exposure to breaches. Analysts should implement end-to-end encryption and securities. Accuracy. Devices may produce noisy or erroneous data. Analysts must apply validation techniques. Bias. Ensure equitable access to IONT devices, avoiding disparities in care delivery. Mitigating these risks enhances IONT's potential for improving outcomes. Alex, a data analyst, is tasked with integrating genomic data into an electronic health record system for a pilot program. However, patients express concerns about misuse of their genetic information. What should Alex do to address these concerns, and what regulations govern the use of genomic data? Answer: Alex should ensure transparency, educate patients on how genomic data will be used, stored, and shared, highlight safeguards against unauthorized access, establish strong governance, create policies for data anonymization and restricted access based on role, employ technology like secure multi-party computation to enable privacy-preserving analysis, align with regulations, adhere to GINA Genetic Information Non-Discrimination Act to prevent discrimination based on genetic information, follow HIPAA guidelines for genomic data security. These actions build trust and ensure legal compliance in integrating genomic data. What are the key ethical considerations when using predictive analytics to identify patients at risk of severe health outcomes, and how should analysts handle patient data to ensure compliance with privacy laws? Answer: when using predictive analytics for identifying at-risk patients, key ethical considerations include informed consent. Patients must be fully informed about how their data will be used in predictive modeling and its implications. Explicit consent should be obtained before any data is used for predictive purposes. Data accuracy and fairness. It is essential that predictive models are based on high-quality data, avoiding biases that could unfairly disadvantage certain patient groups. Analysts should test models for fairness, ensuring that they do not perpetuate health disparities. Privacy and confidentiality. Data used in predictive models must comply with HIPAA, Health Insurance Portability and Accountability Act, and other relevant privacy laws. Techniques like data anonymization or pseudonymization should be employed to safeguard patient identities, transparency, and accountability. Analysts should be transparent about the methodology behind predictive models and how data is being analyzed. There must be mechanisms for accountability, including the ability to explain decisions made by algorithms, particularly when they impact patient care. Ensuring that these ethical and legal frameworks are followed helps mitigate risks associated with predictive analytics while protecting patient rights. Maria, a data scientist working for a large healthcare provider, has been tasked with developing a machine learning model that predicts the likelihood of patient remissions. She discovers that the model's predictions are disproportionately influenced by socioeconomic factors, potentially leading to unfair treatment recommendations for lower-income patients. What should Maria do to address this issue, and what ethical principles should guide her actions? Answer: Maria should identify and correct bias. Review the model's training data to assess whether socioeconomic factors like income, race, and geography have too much influence on the predictions. Apply methods like resampling or reweighting to mitigate the effect of biased features in the model. Test for fairness. Use fairness metrics e.g. equal opportunity demographic parity to evaluate whether the model's predictions lead to disparate outcomes across different socioeconomic groups. Transparent reporting. Document the steps taken to mitigate bias and ensure fairness in the model's outcomes. Provide a clear explanation of the model's decision-making process to stakeholders. Ethical principles. Follow the principle of justice as outlined in the Belmont Report, ensuring that all patients are treated fairly and equitably irrespective of their socioeconomic background. Be guided by the ACM Code of Ethics to avoid harm and ensure that the technology benefits all patients equally. How can genomics data be integrated with electronic health records as to improve personalized medicine, and what challenges must analysts consider regarding data privacy and security? Answer: integrating genomics data with HRS offers significant potential for personalized medicine by enabling tailored treatment plans based on an individual's genetic makeup. Key steps and considerations include integration of genomic data. Genomics APIs can be used to integrate genetic sequencing data into AIs, allowing clinicians to access genetic information alongside medical history and treatment plans. Clinicians can use this data to make more informed decisions regarding medication dosages, genetic predispositions, and treatment strategies. Data privacy and security. Genomic data is highly sensitive, so analysts must ensure it is protected under privacy laws such as HIPAA and the Genetic Information Non-Discrimination Act (GINA). Use encryption and secure access protocols to protect genetic data, both at rest and in transit. Data anonymization or pseudonymization techniques should be implemented to reduce the risk of identifiable information being exposed. Interoperability challenges. Different healthcare systems may use varying standards for genomics data, e.g. HLFA, which can complicate integration efforts. Establishing standardized data formats and interfaces, e.g. FHIR genomics standard, is critical for ensuring smooth data exchange between systems. With proper governance and security measures, genomics integration can advance personalized medicine while protecting patient data. John is a health data analyst working for a health insurance company. His team is exploring the use of blockchain to track patient consent for sharing medical data with research organizations. However, several patients are concerned about the permanence and visibility of their data on the blockchain, especially if it could lead to future discrimination. What should John do to address these concerns while ensuring that blockchain remains a viable solution for patient consent tracking? Answer: John should address data permanence concerns, implement off-chain storage solutions to store sensitive medical data while maintaining blockchain as a ledger for transaction records, use encrypted data with private key access to ensure that even though data is recorded on the blockchain, it remains inaccessible to unauthorized parties. Patient control over consent. Enable patients to revoke consent or modify permissions via smart contracts, ensuring they can control who accesses their data and when. Include mechanisms for time-limited consent where consent expires after a set period, reducing concerns about perpetual data availability. Regulatory compliance and ethics. Ensure the blockchain solution complies with relevant laws like HIPAA, GDPR, and GINA. Maintain transparency with patients by clearly communicating how their data will be used and stored, ensuring that informed consent is obtained. When analyzing sensitive health data, how can analysts mitigate the risks of data misuse or unintended consequences, and what ethical frameworks should they follow? Answer: to mitigate the risks of data misuse and unintended consequences, analysts should implement strong data governance, create comprehensive data access controls, ensuring that only authorized personnel can access sensitive data, conduct regular audits and monitor data usage to detect any unusual or unauthorized access, ensure transparency and accountability, maintain clear documentation of data usage and analysis processes, ensuring that stakeholders can trace how decisions are made and data is used, share the purpose and scope of the analysis with patients and other stakeholders to ensure transparency. Ethical frameworks: follow the principles of beneficence, doing good, and non-maleficence, avoiding harm, ensuring that data usage ultimately benefits patients without leading to harm. Use the ACM Code of Ethics to guide decisions related to privacy, fairness, and non-discrimination in health data analysis. Incorporate the ethical guidelines for health research to ensure that the analysis upholds both ethical and legal standards. By following these measures, analysts can protect patient data while ensuring responsible and ethical analysis.